Hey there, it's Samantha Moe, founder of the Mad to Glad Blueprint and certified parent coach. As you know, I am on a mission to help stressed out parents find ways to stop the yelling, fighting, and frustration at home. Now, my approach, the Mad to Glad Blueprint, is rooted in what's going on in kids' brains because that fight or flight stress floods the brain with stress chemicals, and I call this fire in the brain. And so today I have a guest with me here who is going to talk about his perspective of what's going on with kids and families and the behaviors and dynamics. And so we'll say hello in just a moment. But before we get there, I want to talk to you about the benefits of listening to this video and this interview with Dr. Ty Moe. So Dr. Ty is a pediatric chiropractor who happens to also be my husband, and he specializes in a very gentle neurological chiropractic technique. His office is located in Highland Park in St. Paul, Minnesota, and this is where he focuses on creating a calm, healthy brain from the inside out. So those of you who are used to hearing me talk a little bit, you know I talk about parent coaching as the outside in, what you can do as a parent to calm the internal fire in the brain. For more information on that, just hit up my website, grab your free download of the 10 hidden landmines you might accidentally be stepping on at brighteningconnections.com. But if you want more information about what you can do from the inside out and create more sanity in your family dynamic, Dr. Ty is here to talk to us more today. Hi, Ty.
Hello, Samantha. It's great to be here
Hi.
with everyone today.
Glad to have you. So will you just share about what it is that you do and what's your story?
Absolutely. I'm happy to share. First of all, I just want to thank you, my lovely wife, for having me on this call today. It's exciting to be able to share some of my inside-out approach that you mentioned. And that's, I think, the biggest thing that we see with kids that we work with is we do have a specialty with the chiropractic that we do with pediatrics and neurology. And what that allows us to do is to take kids who are wound up and tense and nervous and start to put some calm into their body. So some of the biggest benefits that we see with kids are overall calmer, better sleep, and more focused and more attentive in their day-to-day activities. We had a mom recently who commented we had adjusted her 4-year-old daughter, and she said after this adjustment, her daughter went home and napped for 2 hours, and then that night slept for 12 hours. Where normally she naps for just a few moments at a time and is up many, many times throughout the night. Actually had a mom this morning who, after her son's first adjustment, said, I had to check on him 3 times last night because I wasn't sure what was going on. He was so sound asleep. And that's, I think, the biggest thing that we provide is not what you would think of with normal chiropractic. A lot of people think chiropractic is just for back pain or just for neck pain, and they don't really know why kids should go or what a chiropractor would do to help a child. And that's one thing that we really focus on.
Yeah, and I know that there are great benefits. And hearing you talk about sleep, anybody out there who's a parent knows that if their child's sleeping well, that's absolutely going to affect their mood and their behavior.
Definitely.
So how does this neurological pediatric chiropractic work?
Good question. What we do that's different than other chiropractors, but also to impact the brain the way we do is we do take a neurological focus. And as you had mentioned, there's stresses placed on a child's body that can come from their outside world. Things like drinking pop or having a chaotic environment or getting in a fight with their sibling. These things can all put stress on the brain from the outside in and cause the brain to get anxious and nervous and not feel as calm and relaxed and focused and attentive as we'd like to see. So with the chiropractic that we do, we actually take an inside-out approach. We find that a lot of parents have done a great job addressing their outside environment, but they've never taken the time or never had the resources to actually look inside their child's body to see what might be stressing their child out from the inside and causing, as you say, the fire in the brain. So,
Perfect.
yeah, with that, what we're looking for specifically, and a lot of parents will say, well, how do you do that? And we look for certain stress points in the spine that are actually activating stress into the brain, sending stress messages from their body up into their child's brain. And what I like to refer to that as is the gas pedal versus the brake pedal. When these stress points are activated, it's like your child's gas pedal is slammed down to the floor. It's stomped down, so their brain's getting all this adrenaline, all this excitement, all this activity all day long, and they can't put the brake on to calm their body down. So we specifically find where the gas pedal's been stomped down, and we start to activate the brake pedal. And when we activate the brake pedal, now we see a calmer, more attentive, more focused child.
Yeah, and I love the way you describe that with the gas pedal and the brake pedal, because what we know from the neuroscience and how it intersects with child development is that if they're used to receiving these chemicals, either because there's a lot of stress in their home environment or there's a lot of stress in their body for different reasons, maybe it's from birth, maybe there's some sort of sensory processing disorder, that what happens is kids fall into this pattern. And so it's great to hear that you can modify the pattern using different approaches. And I'm curious from your perspective why you think this is so important for kids.
I believe it's crucially important because of how not only does it impact the child in the short term, we'll see in the short term, as we said, better sleep, more focus, more attention. The nice thing with what we do is it gives a very immediate impact that something tangible parents can see right away. It doesn't take a year of care to start to see changes in their child. And so in the short term, not only do we see some of those changes, but we also see a stronger immune system. The child who gets sick all the time suddenly isn't having as many sick days at school. We see better digestion. We see lots of changes, both physically and then mentally as well. And that's a big component of what we do is by affecting physical health, it actually has a feedback into affecting their mental health as well. So from the long-term perspective, I feel that what we do is so important because a lot of these kids that struggle with behavior issues or struggle with some of the not able to be calm, the nervousness, the anxiousness in their bodies at a young age are much more likely to be diagnosed with ADHD or ADD later in school, have to be put on medication. We see that same child then down the road could be diagnosed with anxiety or depression, and it leads to this not only a physical health detriment, but also struggles with the mental health side of things as well down the road.
Yeah, and I know that that's something that parent coaches in the field, as in general, are really aware of helping with parent-child dynamics because healthcare costs are so high when it comes to mental illness, and we want to guide parents to helping kids develop good brain health and good relationship skills, starting in their own bodies and in their own families, so that it can then expand and really impact the world and how we're all relating to each other.
Absolutely.
Yeah. And so there's one thing that I want everybody to know, which is if you come to me for your private coaching, what you've heard me talk about is at a certain stage in parent coaching, I can tell if the outside-in approach, if what a parent is doing is going to be enough to repattern a child's dynamics in the family and their behavior so that they feel more calm and comfortable and everybody relates more peacefully and happily together. And I can tell if parent coaching is going to be enough or if they need something else. And so I'll be happy to comment on this more in a little bit as to how I can tell. But how do you know if someone would benefit from your approach?
There are three main things that I like to talk to parents about is to let them know different clues that could be happening that their child could benefit. The first is if their child does suffer, has trouble with any of the things we have been talking about, like the calm, suffering with anxiousness or nervousness, suffering with poor sleep, They get sick all the time. They have a weak immune system. They struggle with constipation. Those would all be examples that are common things that we help kids in our office with. So that'd be number one. Number two, we find a lot of these things actually start back when there's either a stressful pregnancy or a difficult delivery. And the reason for that is the delivery piece is a lot of stress on a little baby coming into the world. And so a lot of deliveries nowadays maybe have to involve forceps or suction, or actually a third of babies in the U.S. are born via C-section, which is a lot to pull the baby out that way. If you're a parent and the baby was being stubborn and you had to induce labor, that's another sign that oftentimes in those cases the delivery was a little more difficult than the parents and the doctor hoped for. So any of those things, oftentimes then we'll see an infant who was colicky, an infant who was very fussy and kind of crabby all the time, didn't sleep well. They maybe had reflux, or they didn't nurse well, they had lots of ear infections, or they were the baby that was always stuffed up when they were young. Those would all be examples of actually one of these issues that started early on. And the reason for that is the upper neck during that delivery is very vulnerable, very susceptible to being injured, and the upper neck has incredible neurological input into the brain. And when that is injured with early on in life with difficult birth, as an example, it really puts that gas pedal to the floor. And then the third thing that we recommend is just the parent who's tried everything. You've been to lots of practitioners, you've been to different chiropractors, you've tried everything, and either you've hit a plateau with what you've tried, or the results are slower than you expect. That'd be another great opportunity that we feel your child could benefit.
Those are really great examples. And talking about pregnancy, that was the point that I was going to make whenever I encourage parents that maybe parent coaching isn't going to be enough. It's usually because there are signs that look like explosive behavior disorder, or signs that look like ADHD, or signs that look like anxiety and depression. And the reason I say that these are signs and symptoms is because I know that these diagnoses are something that can seemingly vanish over time as long as you can make sure that the message going into the brain is really calm and peaceful. And so I know when parents come in and they've given permission for you and I to collaborate on their case, that oftentimes it is that upper cervical where there are some blockages. And there was one thing that you said that was really striking to me, which is talking about kids and the birthing process. And I think that what you're talking about, where there can be really difficult births and maybe there was some pains and some challenges, it kind of painted this picture in my mind of only if there's a really difficult birth, like the doctor was straining to get the baby out, or mom was straining to push the baby out, or there was forceps or something like that. But you know, I think about a baby and how we protect their head when we're carrying them, and how that's the first, or their neck, like that's the first thing that we really want to make sure we protect. So is this something that applies to families where they felt like their delivery process was healthy?
Absolutely. And that's actually a really good point. I'm glad you brought that up. It's certainly there's a tendency with the more difficult births that some of these issues are more likely, but I've checked a baby after a gentle home birth, and even that baby needed adjustment because he wasn't nursing well. And it was a birth that everything seemed to go perfectly fine, yet he really benefited from his first adjustment. So definitely, just with the normal birth process, lots of benefit there as well.
Great. Well, thank you. For those of you who are common listeners of mine, you know that I like to share personal stories. And around 2012 or so, I think Ty and I were dating. We hadn't been married yet. And he was actually invited to a home to adjust the baby within 24 hours of his birth. And it was so amazing because they gave me permission to come with because it was our date night. And it was amazing to watch the process of what you how you adjust a little baby. Could you talk a little bit about that in case somebody's watching? They're like, how do you even adjust a 1-day-old child?
You bet. And that's the nice thing with the neurological chiropractic that we do is a lot of times adults can be hesitant to see a chiropractor because they don't want to be twist, turn, pop, crack. But even more so with their kids or their day-old newborn. But the gentle adjusting that we do doesn't involve any of the twisting, turning that a lot of people associate with chiropractic. And looking at a newborn, in that case, it's extremely gentle. It involves just taking, usually maybe the pinky finger, just a very gentle tap. It's almost like if you were taking a tomato and you were checking to see if it was ripe or not, and you didn't want to bruise the skin, so you just did a very gentle pressure. Very
great. I'm so glad to hear you describe that because I remember watching you go into this baby and you're holding him very carefully and he was very sleepy because he was so young. And you just did this little tap here in his upper neck and it was amazing to watch the process of his body respond immediately. And what happened that I remember is he started gurgling even though he'd been sleeping and it was like a gurgle, 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 gurgle moving up his body and he spit up. And then I think from what the parents had shared with me later when I ran into them in your office, is they had said that that baby latched on and started nursing immediately thereafter. There were no problems.
Yes, exactly.
Yeah,
that's a great example where the body and the view that we take is the body is designed to be healthy, and it's designed to know what to do. So a newborn baby is designed to know how to nurse, how to latch on. But if there's something interfering with that process, it's not going to happen the way it should. And that's where, just to mention with all the different diagnoses we've talked about, from ADHD to sensory processing disorder to OCD, whatever it might be, when someone comes in our office, our goal is not to treat that diagnosis, but instead to turn on normal function in that child and to turn on their own health and healing ability to let their body start to resolve that issue on its own.
Yes, great. Yeah, thank you so much for sharing that. Now, for those who are watching and they have older children, they're 15 years old, they're 9 years old, they're 6 years old, what would be the starting point for a child like that? How do you know if they would even benefit?
Yes. So what we do in our initial visit in office, we sit down, we have a conversation, see what's going on. With our exam, we're able to gently feel the spine. We check for motion. It's oftentimes if something's out of place, it's easy to turn one way but not the other way, so we can identify those changes. And then we also have some state-of-the-art technology that we have special scans that measure along the spine all the different nerve channels leaving the spine to see if, in fact, that gas pedal's stuck on or if the nerve channels are open and clear and the brake pedal's working well. And actually, let me show you one example here. So this was a young child. He was 7 years old when he started care. And when he started, before the chiropractic, he was diagnosed with extreme ADHD when he took his test. And the teacher noticed that they had this form they're supposed to fill out, all the students each day in school, and it was this grid of lots of boxes, and all the students had to fill out, put stamps in the box, mark whether they did or didn't complete those different activities. And most days, at the end of the day, his boxes were mostly empty because his brain was so scattered, not able to focus. He was bouncing all over the place, couldn't get to his task at hand. So we started adjusting him with the neurological chiropractic that we do. And I'll show you the scans here in just a moment, but after we started adjusting him, parents immediately noticed his body starting to calm down. So instead of leaving the school with all his boxes empty, he was actually able to fill up most of his chart each day because his brain, we started tapping that brake pedal, we started putting calm into his brain. His brain could now reorganize itself, start to pay attention, start to focus, and get done what the teacher wanted him to get done. And just recently the parents reported they had him retested, and instead of extreme ADHD, he's barely even qualifying on the ADHD that being a diagnosis.
Wow. And I think what's so critical that you said right now that really jumped out at me is that you're talking about how his brain didn't know how to be calm. And so many times in families and education in the medical world, we tape on a label to a child and we say, well, this just isn't a calm child. But really, when you can separate and you can say the brain doesn't know how to be calm, then we can start doing something about it.
Exactly. Yes. And to illustrate here, I have with his scans, if you can see up top,
hold it up.
Two red bars.
Thanks.
Those are where his gas pedal was stuck on. So this is the head's at the top. Yep, hips down low. And we see in his case that gas pedal stuck on. His body doesn't know how to activate the brake pedal. And that's what those red bars indicate to us. So around the clock, his brain's just getting gas, gas, gas. It's getting adrenaline, it's getting energy, it's getting things that tell him to be active. And the follow-up scan on the bottom here, this is actually then what we saw. There we go. Now you can see that upper neck looking much clearer. The brake pedal is actually able to start going on the way it should. And the difference here between 1 and 2, this is only after 2 months of care. So again, the nice thing that we can see those changes very quickly and start to get results.
Yeah, I love it. Well, thank you so much for taking some time to share with us what it is that you do. I know that the outside in of parent coaching is such a good match for the inside out of pediatric neurological chiropractic. And what would be the best way to get in touch for you for those who are interested in learning more?
If you'd like more information, our website has all of our contact info, has some more information about the scans and what we do. Our website is healthyfamilymn.com. Healthyfamilymn as in Minnesota.com. And if you want to give us a call, our number is 651-789-0033. We're happy to answer any questions you have. If you're interested in having the scans done, we're happy to do that as well. We definitely enjoy any opportunity we get to help a child be healthier and happier in the future.
Oh, that's wonderful. So healthyfamilymn.com to learn more about neurological chiropractic and Dr. Ty. And I know that we're both on a mission to create happier and healthier families. So thank you for being here today and sharing more about what you do, Ty. I really appreciate it.
Absolutely. It's my pleasure. It's great to be here with you.
Nice. Well, I guess I'll see you tonight, honey. Have a good rest of your day.
Good night, dear.
Bye, everybody.
Bye.